contraindications for it. Mm-hmm. So it is safe for the vast majority of people. We have had people who we did not do the ECP on because of their conditions. But the vast majority of people, there aren't any contraindications for that. And then also there are very, 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 very few risks involved with that. Mm-hmm. And it's something that, without any injuries up till now, that's actually a very, very good track record, because there's been a lot of people who've actually gone through that. And in Japan and China, which they have absolutely, literally, probably 100 million people who've actually gone through it. Mm-hmm. Without any injuries, that's actually a pretty good sign.
That is, very good sign. Well, what is the treatment regime like for the ECP?
We get people on, we have them laid down, mm-hmm. We put them into a certain type of a pants, mm-hmm. so there isn't any rubbing that occurs. And then make sure they go to the bathroom
kind of like
stretch
first. Pants.
Yeah, kind of like stretch pants. More comfortable than regular pants. And then we make sure that they go to the bathroom beforehand.
Mm-hmm. You mentioned that, yeah. There is pressure on the bladder, too. Yeah.
Well, yes, and it does actually stimulate the kidneys to a great deal. So you actually get a lot of water loss afterwards because the kidneys are strongly stimulated. And then we wrap them up into the blood pressure cuffs on the legs. Mm-hmm. And it covers from the ankles all the way up to the pelvis. Mm-hmm. And then we start the instrument, and at first, it's a little uncomfortable because they actually feel that pressure on the legs. And people are trying to get used to it. Mm-hmm. Usually by the second or third time that they actually do it, because it is a series of 35 treatments. Mm-hmm. So we do it 5 days a week, an hour a day. And by the time the second one comes around, almost everybody's falling asleep during it.
Yeah, some people have brought in their iPods, listen to music. Some just want to sleep. And
sure, it's a very relaxing type of a treatment, because there are a lot of hormonal types of changes that take place that actually produce, it gets rid of the cortisol. That is the stress, and increases the oxytocin, several different types of hormones, which is, it does shift you into a relaxed state. Mm-hmm. We talk about the sympathetic, parasympathetic whole system. There's a relaxation of all the muscles. The whole nervous system changes. The physiology of the body will change. You'll go from acidic to an alkaline type of state. The stress of the world goes away, and people just kind of melt, which is a excellent feeling. Surprising. Mm-hmm. People are always surprised because they say, when they first start, I'm not going to get used to this, and then all of a sudden they're snoring. But it lasts for an hour. The studies have shown that aerobic exercise is best done for the maximum amount of changes 5 days a week for an hour.
Yeah, and this program is 5 days a week for an hour for 7 weeks, so 35 treatments.
And they found that 35 treatments is where you can get the benefit of the whole aerobic exercise program. And the nice thing about that is those 7 weeks are equivalent to the changes in the body of 5 years of intensive marathon training. So you can accomplish a tremendous amount of changes on that. And even those who have been long-term type of marathon athletes have found benefit with the ECP. So, there isn't actually a limit on that type of thing.
Now, is it painful at all?
We haven't had anyone that has actually said it was painful. It's not that much of pressure. Of course, if you have a inflammation in the veins, of course, that would preclude you from actually having it, which would actually produce pain, any type of pressure on that. But for everyone else, there is absolutely no pain involved. And the discomfort actually becomes very, very minimal because just produces all those great hormones that can make such a huge difference.
Right. Well, when do people start feeling different or better?
Well, that's one thing that people were asking me, and there are different rates on how quickly people can feel the change depending on what their problem is. We have people who actually said that they've started to feel a difference after about 5 treatments, but usually it takes about the majority of people, it's about halfway through. Mm-hmm. But then as we go along, there have been people who didn't really feel a whole lot of change until towards the end.
Mm. And what kind of differences do they feel?
Well, there is an increased energy. Mm-hmm. There is a difference in relaxation. Of course, you if they did have heart pains or shortness of breath, that goes away. Heart palpitations will disappear. The ability of the body to actually do exercise starts to change. So one of the things that we see on people is that they weren't able to go up the stairs before, and then all of a sudden they could. There were people who actually had difficulties with sleeping, were able to actually be able to sleep through the night. One of the things that's actually a huge benefit that people have came in, and I actually didn't know about this when we started the ECP, mm-hmm. is it eliminates a lot of people snoring. Ah. There was a gentleman who came in, one of the first ones that we were doing, and he says, this is kind of a strange question, but does I haven't really noticed a whole lot of difference, but my wife says I'm not snoring anymore, and I've always snored. Uh-huh. And one of the things is that there is a very strong correlation is that the ECP does usually eliminate sleep apnea, wow. which is part of the issue with people snoring. Mm-hmm.
It's wonderful. Now, you said it's been around for 40 years. Is there research that's being done to back up the ECP?
Yes, actually there's a tremendous amount of research that was actually done. It was actually developed at Harvard Medical University, was where they found that did the research along those lines and really started to develop that. Then the Chinese actually took that over and started to do research. And it actually gained, because of the success in China and Japan, that they actually started to do some more research on it and started some research projects with some excellent type of benefits along those lines. So the research is actually quite remarkable at this point, and they're actually finding more and more things that it has been helpful with. That's where they actually got the information on the type 2 diabetes. They're also doing research for its benefit in Parkinson's, other upper motor neuron type problems, MS, because you do get some changes on the oxygenation to the brain, and there is actually some regeneration that occurs. Because we have definitely seen regeneration on stroke. They also have found regeneration in dementia, because dementia is oftentimes a problem of circulation of the brain. Arterial sclerosis actually leads to a lot of problems along those lines, and we can actually start to get some very good changes in cognitive abilities.
A lot of benefits from
tremendous
ECP.
Amount of the benefits. That's why we've really enjoyed the changes that actually occur along those lines. Okay. Of course, one of the problems, people are always asking, one of the questions is, does insurance actually cover it? Mm-hmm. And one of the things is that it really, for the vast majority of people, unless they have actually exhausted every other means of actually doing that, then it usually isn't. So we do have a lot of people go through that, and usually people can expect that that would be more of a cash type of thing. Mm-hmm. But the cost, is quite remarkable. If you
when you compare it to surgery and the recovery for surgery?
The average cost of a care for a patient with heart disease is usually about $65,000. As you're looking at just the basics, if you're getting into surgery, then you start to get into the hundreds of thousands. So the cost on that is just simply, no comparison.
Well, thank you, Dr. Prather, as always. We're out of time for this week.
The Prather Wellness Center is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. You can connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.